Good afternoon, everyone. We're off to a little late start because we're waiting for the room to be filled. Thank you all for taking time out of your busy evening to come and spend some time with myself and Dr. Pottinger. So for those of you who are new, well, Dr. Pottinger is our main host today. He'll be talking to us about our immune system and in particularly vitamin D. Now, Dr. Pottinger resides in Trinidad. He's a gynae oncologist. He's like one of the best doctors I know on this planet. He lives here in Trinidad and Tobago, and he's originally from Jamaica. And I'm Donna Walters, and I've started this series to really educate folks on their health. Without health, there is no wealth. And we are removing gatekeeping. So we're no longer going to gatekeep information. We're here to share. So most of the videos, we did a couple of sessions already, mainly related to women. Today is for everybody, both men and women, right? Because we're going to be talking about our immune system. So we're going to be, focusing especially on vitamin D and the powerful role it plays in keeping us strong. Now, this is a season in the US, people are, it's winter, and also in the Caribbean, coming up in the dry season. We have a lot of people getting sick at this time of the year, right? And we remember COVID and what happened during COVID. Many of us weren't strong enough to withstand the issues with COVID. So as we step into 2025, I want to say Happy New Year to everyone. I'm wishing everyone all their, wishes and dreams will come true. And there's no better time to take charge of your health, which is now, right? So we want to start the year very well. Now, Dr. Pottinger is an advocate for, not just taking medication. He looks at the whole holistic side of things to help us be better. So he'll be here to share his expertise today. Before we dive in, I just want to remind everyone that this towards the end, we'll have an interactive conversation, but in the beginning, it's between Doc and I, and he'll be doing most of the presentation. So please go and get your paper and your notebook. I cannot emphasize that, right? He'll do his best to break things down in layman's term for all of us. All right. I also want to add some disclaimers here to say, one, we're not here to cure anything, to give you advice how to cure anything you may have. We are not here to tell you, do not follow your doctor's orders. Continue to listen to your doctors. What we hope is that much of what you'll ask more questions of your doctor, when you go to your doctor to really understand what's going on and not just taking things at face value. So, Doc, we're going to get started. So, to begin, can you help us understand exactly how the immune system works and why it is so important to keep it strong? So, welcome, Dr. Pottinger. The floor is yours.
All right, thanks. Donna, I think just before I get on to the immune system, I just want to touch a little bit on the classic role of vitamin D that most people know about, right?
Yes.
Start back 100 years. All right. So there was a deficiency called, well, a disease called rickets. And a little over 100 years ago, it was discovered that this was a deficiency of what they thought was a vitamin, and then named it vitamin D. So I just wanted to touch on the classic role of vitamin D, and then we come now to the non-classical role. So all right.
Right, yeah. I think most of us remember that in school.
Yes, so let me just go over it quick.
Rickets, yeah.
Yeah, in the skin, there's a fat called 7-deoxycholesterol. And this is converted by the ultraviolet light to what is called vitamin D3. I won't call it big names because they're long, and we just want to leave it at
Not hearing anything.
Doc, I'm sorry. Can you unmute, please? Doc, unmute. Sorry about that. Unmute, please. Don't know what happened there. Okay, go ahead. Yeah, we're hearing you. Go ahead now. I lost you again. Unmute. You keep going. Yeah.
All right, what I was saying is that in the skin, there's a fat called 7-dehydroxycholecalciferol. And under the influence of ultraviolet rays from the sun, this is converted to what is called vitamin D3. The D3 is then carried in the bloodstream to the liver, and the liver converts that to something called 25-hydroxycholecalciferol. I might see another name, call it calcifidiol. All right, this calcifidiol is then carried in the blood again now to the kidney, and the cortex of the kidney converts this to 1,25-dihydroxycholecalciferol. And this is the active form of vitamin D, which we need to do all the things we need to do.
So,
All right.
Doc, one question, sorry, you're saying so just to kind of understand what you just mentioned, you're saying the vitamin D comes from the cholesterol?
Yes, there's a fat called 7-dehydroxycholesterol. And the sunlight catalyzes a reaction that changes it to vitamin D. But that vitamin D is not biologically active. So it is then carried to the liver, and the liver now converts it to 25-hydroxycholecalciferol, which is still not active. So that is by the name that is converted in the liver to the active form, which is called 1,25-dihydroxycholecalciferol. And this reaction is controlled by a hormone called the parathyroid hormone. The parathyroids are 4 glands behind the thyroid, and they produce parathyroid hormone to catalyze this reaction in the kidney. All right. So because the parathyroid hormone formation is stimulated by a fall, well, the concentration of calcium in what is called the extracellular fluid, the formation of 1,25-dihydroxycholecalciferol, or 1,25-D, will increase whenever calcium concentration in the extracellular fluid fall. All right. This activated vitamin D, which is the 1,25-D, is then carried to the small bowel, where it catalyzes, it causes certain reactions, one of which it causes a calcium binding protein. Then it also an enzyme, calcium stimulated ATPase and alkaline phosphatase. Don't remember all of that. All of these things promote absorption of calcium from the small bowel. So I hope everybody could follow that. So this is the main thing that we knew about vitamin D going back over 100 years. However, today we want to focus a little bit on the not rickets, because we hardly have any rickets around here. Rickets is still in like England and those places where, you know, the sunlight is not extensive, not for a long time per day, and sometimes of the year, the 3-4 hours of sunlight, and it's not bright sunlight. Plus, because of the coldness in those places, they tend to be indoor a lot, and when they're outdoor, they have on a lot of clothes, especially during the winter time. So they're not getting enough sunlight to catalyze this reaction that I just said there. So in those places, especially Black people and Indian people, Black and brown people, let's just call it that, who live in these countries, they have a high incidence of vitamin D deficiency. In England, it's estimated to be about nearly 90% of all of the Black and brown people have vitamin D deficiency. And this is crucial. Yeah, this is crucial because vitamin D is vital to the function of the immune system, so that we can counteract bacterial infections, viral infections, and even cancers. So this is one of the things that explain why Black and brown people in these countries had a much higher mortality rate from the COVID virus compared to the white population, right? So let me just try to stick to what I wrote, so I won't be jumping all over the place, so people will get most of what I had to say. All right. The link between vitamin D and the metabolism of bone is well known. The links between vitamin D and the immune system is not well known, even though there has been good information going back at least 60 years, particularly with TB. The TB used to kill people plenty, and that was really rampant when we didn't have antibiotics. and they had discovered that if you give the people with the TB like cod liver oil, they would improve, and even some people could live a long time, you know, if they keep up the cod liver oil. But they didn't know what was the active ingredient in it, and the active ingredient in it was primarily vitamin D.
Are people still having TB?
Yes, it is still around, especially immunocompromised people. So like I tell you, I mean, Black people living in, you know, cold countries, and people have to be huddled up and endure all the time and thing. And so this bacteria, you know, it's thriving that kind of situation. And a lot of these people are severely vitamin D deficient. So the immune system is handicapped to deal with it.
Okay.
Yes. All right. The amount of vitamin D needed to prevent rickets is very small. And these supplement levels were set approximately 100 years ago. All right, so these very small, low levels, a lot of the Ministry of Health across the globe still using those low levels as the recommended daily requirement, and they're woefully inadequate. They should be at least 10 times higher in order to have the desired effects on the immune system. All right, so those low levels for supplementation was low as 400, what is called international units, you know, a supplementation daily. And it is really, you need 10 times that, like 10, 4,000, 5,000, 6,000 international units a day to keep the immune system working well. Vitamin D is a fat-soluble vitamin and can be stored, all right? So there is an irrational fear of vitamin D toxicity because the fat-soluble vitamins A, D, E, and K, if you take too much, there's a potential problem of getting too much, and because this is stored and it could cause problem. And as I just said in the little preamble, vitamin D can cause it can cause the calcium levels in the blood to get high. And if the calcium levels get high, it can cause a lot of problems. It can affect the central nervous system, various things that I don't want to get into right now. So because of it being, you know, fat soluble thing and this irrational fear of toxicity across the globe, most of the Ministry of Health, the requirements, the daily requirements are very low, and too low actually. Dark skin is not as efficient as white or pale skin in making vitamin D. So Homo sapiens, modern man, us, we evolved in Africa where it was roughly 12 hours of daylight and 12 hours of darkness. So and that time we wasn't living in house like we're living in house now. We didn't have on all this whole heap of clothes like we have on plenty of clothes now. We used to spend plenty of time out, you know, chasing after food and our foraging for berries and fruits and tubers and things like that. So we used to soak up plenty of vitamin D, even though our skin have a lot of melanin, which filter out. The melanin act like a natural sunblock that filter out some of the dangerous rays from the sun that can damage the skin, cause sunburning, and can, you know, eventually lead to skin cancers. So most Black people who have dark skin, we can be out in the sun all the time and we won't get any skin cancer. All right, so that was, yes, that was an adaptation and probably one of the evolutionary things why our skin is dark, because we evolve in this kind of environment, 12 hours at least of, you know, overhead hot bright sun. So we were hardly wearing, as I said, clothes and not in house and all them kind of things. So it soak up a lot of vitamin, made a lot of vitamin D from the sunlight. So vitamin D deficiency is very, very unlikely to happen in people, you know, from that time. And because of this, you know, we living in Trinidad here and Jamaica and the whole Caribbean in tropic, it still carry over that people believe, oh, we in a sunny environment, we can't get vitamin D deficiency. And it's not true. The deficiency is very rampant around here because, you know, we have on plenty clothes most of the time, and we're in the house most of the time. We come out of the house and go in the car, then reach at the office and inside of the office all day and come out. We're hardly getting any sunlight, right? So and our skin dark, it's not as efficient. It's about 1/3 as efficient as the white skin in making
Okay.
vitamin D.
Okay.
Yes. All right. All right. The dark skin acts like a sunblock to filter out certain wavelengths of ultraviolet light that can cause sunburn and skin damage that can lead to skin cancers. All right. As modern man walked out of Africa and went to northern altitudes, especially above 35 degrees latitude, where there is much less sunlight, the dark skin would have been a disadvantage with respect to making enough vitamin D. Hence, there was evolution towards lighter skin, which allowed more of the ultraviolet wavelengths to penetrate the skin to catalyze the reaction needed for the manufacture of enough vitamin D. You heard all of that?
Yeah, so you said as we evolved, we became less efficient at really catalyzing the vitamin D.
Yes, so
Where
I'm
the
saying
skin
when we
got
walk
paler
out
and
to
paler as
Africa
we go
about
north. When we keep
18,
going north, we keep getting paler and paler.
yes, and then you see there's another group of humans, early humans, primitive humans called Neanderthals, and they evolved in Europe and what is called like Western Asia. And because they're in that climate, they were pale. So there was some amount of inbreeding between the Homo sapiens and the Neanderthals. So you find like most Europeans right now, they carry around 3% of the Neanderthal genes. Whereas people from in Africa never really had no Neanderthal genes. And you might have people who are purebred Africans don't have any. Right.
Okay.
All right. It is believed by some, I'm going to just, what I just said, I'm going to read it again. It is believed by some that Homo sapiens crossbred with another human species called Neanderthals, who inhabited present-day Europe and Western Asia. They were white or light skin, and this accelerated the evolution of light skin Homo sapiens. So Europeans still carry approximately 3% of the Neanderthal genes. This is probably the only beneficial effects of white skin. The other thing is that older people are far less efficient in making vitamin D because the skin dries out. We don't have as much oil, and that the cholesterol in our skin is lower as we grow older. So even if you spend plenty time out in the sun, our ability to make vitamin D is vastly reduced when you get older because the substrate that need to be worked on by the ultraviolet light is very low.
Oh, so you're saying that under the skin, the fat under the skin is low, so that is the
Yes, as we
issue.
grow older, we lose the cholesterol.
But I thought as we grow older too, our cholesterol level increases. So more and more doctors are giving medication to reduce cholesterol in the body.
That don't happen. But we're talking about cholesterol in the skin.
In the skin, okay.
Yes. And as we grow older, the skin dry out. You ever see older people, the skin wrinkle up and dry and not as, you know what I mean? Greasy as it used to be. All right. All right. So this same thing that happened in black skin too. This occurs. All right. So this occurs in black skin and white skin. Hence the need for supplementation in old age, because you're not getting enough from the sun, and it's only as we can get vitamin D from the diet, but the majority of it come from this reaction in the sun. So if people not making it from the sun, and most people that are deficient in vitamin D, then they will have low levels of vitamin D. So this is a situation where we really should supplement. We should supplement. Yes, you were saying something?
No, go ahead, dog. Go ahead.
Yes, all right. It is believed that the people who are overweight or obese people need higher vitamin D supplementation because a lot of the vitamin D gets stored and is trapped in the fat and is not readily available for use. So it is not biologically active. It gets trapped in the fat in the obese people. So they need more. They need more supplementation so that they will have a better level of free vitamin D in the bloodstream that can go through the reactions I mentioned before to get the active form of vitamin D.
Okay.
All right, another disadvantage of being obese, and we can tie it up with the recent COVID. A lot of the people that were dying from the COVID are overweight and obese Black people. You get that?
Yeah.
And it is believed that a big part of it is because they were grossly vitamin D deficient, and hence the immune system is handicapped. All right. Fatty fish are a good source of dietary vitamin D. All right. They cannot make vitamin D because they are covered with scales that will block out the sunlight. But they eat plankton. Plankton is algae and fungi and protozoans and all kind of things like that in the sea that they make the vitamin D, and the fish eat them, and it accumulates right up through the food chain. So the fatty fish, they eat the plankton, and they will get enough vitamin D, and if we eat them, we can get a fair amount of vitamin D. That's why the cod liver oil of significant vitamin D. Modern man is the only animal that does not live outdoor and is covered up most of the times. So we handicap ourselves by moving indoor and wearing clothes with respect to manufacturing vitamin D. So vitamin D deficiency is very common even in the tropical countries because of this. Right? Example, in Saudi Arabia, which is sunlight all the time, it has been shown that approximately 90% of the people are vitamin D deficient.
What?
Plus it's a Muslim country.
Oh,
so
really,
especially the women are covered up from head to toe. Their face and everything. So even though they are brown or Black people, they hardly get any sunlight exposure. And the vitamin D deficiency is very bad. And this applies to all Muslim countries. So like when these people move to somewhere like the UK, in places like Bradford and Oldham and Rochdale and all those places, have a lot of people from India and Sri Lanka and Pakistan and things. Vitamin D deficiency is rampant, and they still have rickets and plenty of the problems that are associated with very low vitamin D levels because they close up and they're in a poor sunlight environment.
And I guess, Doc, this will also apply to many of our diaspora folks who live outside the Caribbean, in the US and in the UK. So it's very important for them to pay attention in terms of their D levels.
All right.
But
you're saying?
I want to know, how do you know though if you're deficient? How do we go about knowing that?
But they don't want to wait until clinical signs like rickets and bow leg and everything that pass, you get it. No flu, no pass you, the bacterial thing you get, sort of thing. And those are the kind of thing. But if you have a doctor who is tuned in, especially in those places, Black and brown people should get the vitamin D levels checked. I would think at least once a year, and everybody should be supplementing. Because you see, you're just saying like another virus or some other infection growing again and coming again. And the same thing going to happen again if you come across people who have very low levels of vitamin D that cannot deal with them viruses.
So how do we know what vitamin D to take? You're
jumping all over the place. Let me finish.
Oh,
the supplemental vitamin D is vitamin D3. There's also one called vitamin D2. But the vitamin D3 is the preferred one because the half-life, it stays longer in the bloodstream. So if you give up same bolus dose of vitamin D2 and vitamin D3, the vitamin D2 will fall much faster. All right?
So D3 is the preferred one?
Yeah, D3.
Regardless of the brands and all of that?
Yes. All right. So let me just go back over quickly what I just said there. Some of the reasons for vitamin D deficiency: Black and brown skin, plenty clothing, living indoors most of the time, a low fatty fish diet. If you're not eating things like eggs or liver and milk, or like say, if you're a vegan or a vegetarian, you're highly likely to be vitamin D deficient if you're not taking some kind of a supplement. So the vegans, because you could get some vitamin D2 from mushrooms. But I don't know if everybody, the vegans, eating enough mushrooms to get enough vitamin D. D2, you won't get D3. D3 is basically from animal sources. All right? So vegans have to be supplemented. So black and brown skin, plenty clothing, living indoors most of the time. And if you're a vegan or a vegetarian, high chance you could be vitamin D deficient. All right. If you're, as I said before, if you're overweight or obese, you're going to need more. So you need supplementation. As a high chance you're vitamin D deficient. If you're an older person, anybody over say 60 and so, really should be supplemented because their skin dry and they're not very, if they can't make much vitamin D, even if they're getting good sunlight. All right. People who wearing sunscreen. Not many black people who wearing sunscreen, but lighter skinned people in the tropics, you see people going to Maracas and you see them rubbing down with them sunscreen all the time and things and so. The sun, so even places like Australia that have plenty sunlight, you have significant vitamin D deficiency because the paranoia are getting skin cancer. So 30, 40 years ago, the dermatologists and them said basically you must be in the sun and you must do everything to block out the sunlight and things. So there's a real big uptake in the sunblocks, and there's a concurrent decrease in vitamin D manufacture because the wavelengths can't come in.
Guys,
All
you
right.
heard that though.
And if you live in north or south of the equator, more than 35 degrees latitude, the sunlight is not good in those places. So older people who like in hospital and nursing home are people who are can move around, the immobile, so they inside. I mean, all them people, most of them will be vitamin D deficient. All right, because vitamin D is crucial to the proper functioning of the immune system, especially what is called the innate immunity. Innate immunity means a natural thing, it's not, the other one is called the adaptive immunity. So the adaptive immunity is triggered after you have been exposed to something and you survive it. So you have some cells called B cells and T cells. So the T cells and they will remember, like if you get mumps or rubella and chicken pox and things like that, the T cells will have some cells called memory cells that remember it. And when those viruses show up again, it transforms into something called a plasma cell and boost the antibody response because those T memory cells can stimulate B cells to produce antibodies, okay, to protect you there. But that is, you're going to develop that after you survive the primary exposure.
The first one, yeah.
Yes, so the innate immunity is very crucial so that you don't dead from anything that you get the first time. All right. And
Sorry,
vitamin,
Doc, just to clarify, you're saying the innate is your natural immunity.
yes.
You're saying that you're born
And
with,
that is the front line.
without getting any diseases.
Yes.
Okay.
So the first time you get exposed to something is your innate immunity will protect you. All right.
Okay.
So, and if you have vitamin D deficiency, your innate immunity won't be good. All right. So let me just go again. Vitamin D is crucial to the proper function of the immune system, especially the innate immunity. The above explains why COVID-19 was particularly devastating for Black and brown people living in northern regions, right? And the obese ones and the elderly ones and the vegans, they suffered more than everybody else. A study in the UK in 2021, right during the COVID, showed that like babies born in the winter were commonly very deficient because the mothers were deficient too. So basically every pregnant woman should be supplemented with vitamin D, even in the tropics here. So because it can affect the development of the baby in many, many respects. All right. So when they check it, the Black and brown people in the winter, those babies and so, they had less than 20 nanograms per mil. If you have less than 20 nanograms, it's considered that you're deficient. And if you have less than 30, they call that insufficient. So really and truly, we want to be over 30 nanograms per mil. And all these babies were less than 12 nanograms per mil. All right, in this summertime, it gets a little better. but the vast majority were still less than 20 nanograms per mil. So they were vitamin D deficient, right? Below the 12, they call that deficient, and below the 20, they call that. So they say sufficient, but it's really insufficient. If it's below 30 nanograms per mil. All right. So in the UK, only about 5% of newborns are supplemented with vitamin D. You can give it to the mother, so make sure the mother okay, and it will pass in the breast milk to the baby. And this is different for UK from the mainland of Europe, because the supplementation rate in the mainland of Europe is very high, much higher, up in the 50-60%. All right, so maybe we just go back over things again a little bit. So we need sunlight. The most of the vitamin D is made from the sunlight, acting on a fat called 7-deoxycholecalciferol, Some of the vitamin D, less than 1/3, we will get from our diet, especially if we're eating fatty fish, things like sardines and mackerels and tuna and things like that. All right, so this vitamin D travel to the liver, where it is converted to 25D. We're just calling it 25D. That 25D is what is tested when you're checking for your vitamin D level, but it is not an active thing. That will then go to the kidney, where there's an enzyme there that transforms it into 125D, which is the active form. Almost every tissue of the body can convert the 25D, but the majority is done in the kidney. So in things like the placenta and the spleen and other tissues, the bowel and things like that, the liver can also do it. And the immune cells, particularly what is called the macrophage and neutrophils and something called dendritic cells, all of them can convert the 25D to the active form, which is the 125 vitamin D. You got that? You hearing me? Donna?
Yeah, I got that, Doc. I got that, Doc. And audience, if you have questions, one second, Doc.
I don't want to like be talking to myself, and if you say you're understanding, I assume other people would understand.
Okay, so Doc,
The 125.
hello, Doc.
Yeah.
Yes, I'll just say to the audience, if you have questions, you can drop them in the chat. So what I got from the summary is that, one, we need a sunlight. That sunlight will activate, that relevant fat that's in the skin to produce the vitamin D. And if we're not getting enough sunlight, we can supplement by eating, fatty fish and so on. But you encourage some subsets of people to take supplementation, like pregnant mothers or the elderly and so on, to take a bit more
vegan
supplements. And the vegans, yes, as well. And I can attest to trying to go vegan and not feeling strong as I wanted to, no matter how much I eat. And then had to supplement with certain things to help me along the way.
Well, so vitamin D probably is the most important one to supplement with.
Yeah.
Mm-hmm. You need things like magnesium, because magnesium work with vitamin D. And you need things like vitamin A. They also work together.
Oh, vitamin A. Okay.
Yes. All right. Okay. When you have the 125D, no, this is a hormone. This is not like a vitamin. This is a hormone now that have receptors. So your bone have vitamin D receptors. Your small bowel have vitamin D receptors. All your immune cells have vitamin D receptors. So once we have 125D, most of it is made from the kidney, that then travel in the blood to the bone. All right, to facilitate deposition of calcium and phosphorus in the bone, to strengthen it, right? Because if you don't have that now, the bone will remain soft, and make people used to have real bad bow leg and K leg and all them things. That was something called osteomalacia, right? Because the bone couldn't get hard, because the vitamin D is crucial for the absorption of calcium and phosphorus into the bone. That vitamin D2 will also go to the small bowel to facilitate the absorption of calcium, right? So if in the bowel, absorption of calcium, and then the calcium can be utilized in the bone, in the skeleton. All right.
Okay, so the vitamin D and the calcium go hand in hand, you're saying, basically.
Yes. but you don't usually have to supplement with calcium. If you have adequate amount of vitamin D, it's very difficult to get deficient in calcium if you're eating at all, right? So any kind of meat thing, and dairy thing, and egg, and anything like that, it's very difficult to get calcium deficiency. You have to be on a really weird diet in order to get that.
So if people are calcium deficient, then like having osteopenia and so on, it's really vitamin D they're deficient in.
Yeah, the most of it is the vitamin D. So the older people who have what we call osteopenia or osteoporosis, you could give them, once the vitamin D are sufficient, then you could supplement them with calcium too, and that will reverse the process faster.
Okay, so somebody's asking, so if you're a vegan, what you're saying is if magnesium and vitamin A should be taken along with the vitamin D.
Yes.
Is that mainly for the vegans?
Yes, for anybody.
Okay.
But vegans, if they eat plenty green leafy vegetables and things, they will get enough K and other things too. It's hard to get deficient with these things unless you have a really, really weird diet.
And a lot of people have poor diet, Doc. A lot of people eat a lot of flour and sugar and all that stuff. The Caribbean diet, lots of starch. But
Yes,
we
but
may
if
not
they
be
eat
eating
the green leafies and if they eat any kind of animal products, right, and especially fatty fish. There was a study, I looked at it this morning, that was done in Tobago back in 2011, 2012, somewhere around here. And they were looking at men over 65 and the vitamin D 25D level was just about less than, was 2.8% of the people were severely deficient. And less than about 25 was lower than 20. But it looked like, you know, they were checking. It's probably not a representative sample because it was a lot of fishermen and things like that. And there were people who were eating plenty fish. So if people eat people eat plenty fish, it's difficult to get deficient.
Okay.
All right. So that, when I read the thing, it is a kind of misleading thing, because if the fishermen, they're more outside and they're topless and they're pulling seine and blah 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 and thing and so, and they're eating plenty fish. So it kind of probably skewed the thing a little bit.
Yeah, and somebody wants to know how much sunlight do we need daily for vitamin D? Say an hour in the sun?
Well, you see, these questions, they're simple because, as I said to you, it depends on your pigmentation. So a very dark-skinned person will need to spend longer time. A light person will need to spend less time. So if I saw something this morning that was saying, if you are a Caucasian, a very light-skinned person, and you on the beach in the bright sunlight for about 10 minutes, that might be enough, and then you can put on your sunblock, so that you're not burning up and then setting yourself up. All right, cool.
Okay, so like dark skin like me, we need to be out in the sun.
If we want to extrapolate from that, that white person who need to spend 10 minutes to get enough, I think they said that would make about 1,000 international units. 10 minutes. We could have probably extrapolate and say a black person, a very dark-skinned person might need to spend 30 minutes, 40 minutes in the same sunlight to get the same amount. You understand me?
Yes, yes.
All right. So
Doc, if people in Africa then perhaps will have a low level of deficiency, you would say?
No, only
if the sun a lot.
If they're in plenty sunlight and not wearing clothes.
Okay.
And if they're eating plenty fatty fish, right? So even in Africa, there's a study I looked at this morning. Let me just jump to it because we're jumping up and down. I wanted to say some other things here, but since this come up, all right. This study was reported in 2014. It was a study by somebody named Hilger et al. So people might go and check it. It's in the British Journal of Nutrition. And this study, they looked at 168,389 participants from the general population from Europe, North America, Asia Pacific, the Middle East and Africa, and South America. So it's basically the whole world. All right. And they check them for the mean amount of the 25 OHD, that the 25D. And 88.1% of people were insufficient. Right. If you're using less than 30 nanograms per mil as being insufficient, 88.1%. And that included African, Caribbean, and South America, and Middle East, and all of that. All right. When they look, and if you look on less than 20 nanograms per mil, 37.3% of the people were at insufficient. And if you look at the mean value overall in all of the people then, there was a 6.7% deficiency in the mean values, right? So that means white people and everybody and thing and so. So it is not a rare something, okay? Even in Africa and Middle East and Caribbean.
And a lot of people don't know that. Yeah, that's the thing. Many of us don't know that. Yeah.
Yes, that's why I'm saying a lot of people here, even that I was talking to some doctors, friends of mine, within the last week. I send your first thing out to them. And even them was poo-pooing the thing. They were saying, but vitamin is something you need in very small quantity and we in the tropics and blah, blah, blah. So I needed to start explaining to them that it's really not a vitamin, it's a hormone. And start to explain some things and the levels that is needed, not these little 400 microgram to 1,000, not microgram, 400 international unit to 1,000. That is so minuscule. You would still be deficient. So,
and I've read where too, Doc, just to say I read where mentally as well, your mental health can be impacted if you have low vitamin D levels.
So
is that true?
Some of the things them right now that can be impacted. So we leave it now. I think I beat that out and most people know that. All right. So you have the non-classical rules of vitamin D. All right. You see things like what them call mycobacterium, things like what cause tuberculosis and leprosy and septicemia and all them kind of things in your bloodstream. The people who are deficient in vitamin D can't counteract these things and the death rate will be very high. All right. So it decreases infections due to those kind of things. Also, like viruses and things, especially upper, respiratory tract infections, COVID, flu, cold, all them things were happening every year. If people are vitamin D sufficient, you won't get no flu and cold and all them things are very transient or mild. It's not going to kill you, end up in hospital. All right? All right. Things like autoimmune diseases will be much lower if people are deficient in vitamin D. So things like multiple sclerosis, type 1 diabetes, SLE, that is lupus, inflammatory bowel disease like Crohn's and ulcerative colitis, all them things would be less, far less, if there was no vitamin D deficiency. So it's just over the last 15, 20 years we're discovering all of this. So there are studies going on right now looking into treating these autoimmune diseases with vitamin D. Yeah, and hopefully it will bear out good, right? That's kind of thing. So you find anything that vitamin D will decrease the risk of something called the cytokine storm. This is what was killing a lot of people in the COVID thing. All right, so when people get respiratory tract infection, you could get something called the acute respiratory distress syndrome, where the immune system trying to kill these things so much that you get an overreaction of the inflammatory, if inflammatory cells like the macrophages and neutrophils and dendritic cells and so on and so on, and they release certain chemicals called cytokines to attract more cells and increase blood flow into the area and thing, trying to kill the virus so much that it causes so much damage that you get a lot of what is called inflammatory exudate that then clog up your alveoli. So there's very poor exchange of oxygen and carbon dioxide. And the people literally drown in their own inflammatory fluid.
Wow. So that's like mucus. The cytokines are like mucus that takes over the lungs.
And that was always killing most of the people in the COVID. And then initially, when people oxygen saturation start to fall because of what I just explained, and they go to hospital and then they put them on ventilator and that made the situation worse.
Wow.
With the positive pressure from the ventilation, you just pushing more inflammatory things down inside of the lungs and you kill them faster. And it took a while for people to realize that people on the ventilator was making things worse. So it's only when you realize that this is a big inflammatory thing, is the acute respiratory distress syndrome. People drowning at their own inflammatory exudate because the immune system too excitable. Then you start to use things now to down-regulate the immune system. So they started to use a powerful steroid named dexamethasone. So the dexamethasone then tone down the inflammatory response, which is normally caused by the innate cells, the macrophage and some cells called dendritic cells and neutrophils and things. So that when you tone that down now, people had a little better chance for some cells called T cells, natural killer cells, and other things to come in to help to kill the virus so that they could survive. You follow all of that?
Wow, it's a lot, it's a mouthful. Maybe you could summarize it a little bit, but basically what I'm hearing you're saying is that due to this deficiency during COVID, many people, the immune system was not able to fight.
No, the immune system was trying to fight it, but it was an overreaction.
It was fighting itself.
Immunity. And the overreaction caused excessive inflammation.
Okay.
Then damaging the lungs with so the alveoli are some little sacs that like some little balloon that you need to have oxygen absorb and carbon dioxide come out from the bloodstream into it to then breathe out. And that process couldn't take place because so much
excitement.
It was there that couldn't take place.
Okay.
So it's like the people were drowning.
Okay, so was it like the immune system attacking itself then?
It made the situation worse.
Okay. So the immune system was basically fighting itself for saying?
In the early part of the pandemic, we were actually making the situation worse with the ventilation things. All right?
Yeah.
So what I'm trying to say, if anybody can put 2 and 2 together, you have a possibility that if everybody in the world had sufficient levels of vitamin D, we would not have any pandemic. You got that?
Yes, I got that. That's a bold statement. if most of us were, yeah.
Is that
but I don't think there were that many people were thinking about vitamin D. Yes, you went to school,
well,
you
I
learned
knew
bio.
about it, and I was talking about it, but I am just somebody that somebody don't like to listen to. So even in my class site, we have a WhatsApp site, over 100 people on it. And I was pointing this out, and it was like pulling teeth. And these are some of the brightest people I know. Yeah. And then when I was trying to point out that the levels that all the authorities saying to supplement with were far too low, at least it should be at least 10 times the amount in order to protect you, that sort of thing. And even at that, these are bright people, and most of them never know nothing about it and was very reluctant to believe what I was saying.
Yeah. So I have a question for you though. During COVID, I know I took a lot of vitamin D. I did not get COVID at any point, knock on wood. People used to tease me.
You most likely not.
You're God's favorite. And because I took a lot of vitamin D. But
Yes.
one of the main vitamins that we were encouraged to take was vitamin C. That it was critical for the immunity.
We can deal with that as next time, but vitamin D more important.
The vitamin D is more important. Okay, so somebody had that question. So hopefully that answers your question about vitamin C and its importance.
Yeah, we can talk
over vitamin D.
But D is the general.
Okay, D is okay.
All right.
He's the king.
I can just point out something else again, which never make any sense to me at all. And even though you're talking to people, even people at governmental level, nobody was listening. So we have a situation where we decide to shut down, tell everybody to stay indoors and wear masks and blah, blah, blah. So we're making the sunlight exposure worse. People couldn't go on the beach. And I'm saying the thing about the beach is nonsense, because people on the beach during the day with the sun, and Maracas, the sun bright and breeze blowing all the time. If I even cough here and I have it, if somebody even 3 feet, 4 feet away from me, they can't get it, I can't affect them, because the virus can't survive in this bright sunlight and breeze blowing, right? And if you're in the sunlight out there, we'll be manufacturing vitamin D I just said a while ago, probably a dark-skinned person out in the Americas for 30, 40 minutes, they will make at least 1,000 international units of the vitamin D and all that kind of thing. And we were banning people from going outdoor, being on the beach. So even after, when they decide to try to ease up on the thing a little bit, they ease up that people could start go to cinema. So you're in cinema in air conditioned and crowded place, no light. Then you could go to places like casino in air conditioned, plenty people inside it. You know what I mean? The air circulating inside it. And I'm saying, what kind of madness is this? While at that time, people still couldn't go on the beach. And if police come and see you on the beach, they could have fined you.
Yeah, yeah. You see, because many times we don't understand how to advocate for ourselves and speak up, right? We just accept what is given to us out there. So,
I
you
was
know,
talking
yeah.
about this, and it's almost like I am crazy because WHO said this and CDC said that, but you know what? I reach a point now I can think for myself. I mean, I have enough medical knowledge and information, and I try to be a critical thinker. So I work out a lot of things, and usually I am right. I don't want to sound like a fool of myself, but some of them things that I just mentioned just never make no sense.
Yeah. So for those of you who have questions, please drop them in the chat. I see someone with their hands up. Just drop it in the chat. Somebody wants to know, Doc, is the lymphatic system and the immune system the same?
The lymphatic system is part of the immune system. The lymph is just part, all right. Yeah, we don't want to go to that because when this distract me is a whole different talk. To talk about the lymphatic system versus the veins versus the arteries and all that kind of thing.
Okay, but it's a part of it. Okay, so we leave it at that. It's a part of it.
Yeah, the B cells and them, they are made in like some things named lymph nodes are stored there. And this lymphatic fluid will have to drain back into, because this is fluid out in the tissues, and that have to drain back into the bloodstream to bring the B cells and them into the bloodstream. But that is a whole long talk.
Yeah. Okay, no problem. But there's one more question before you go. One question, because several people have asked, how many units of D3 should we be taking every day?
Let me deliver my thing now. And all these
You're going to tell us that. Okay.
All right.
Okay, so listen, guys, it will come. Go ahead.
All right. The vitamin D deficiency can cause hypertension. How many people know that? So some of what we call in is essential hypertension, where we have no reason behind it and thing. Some of them people might be having higher blood pressure because they're vitamin D deficient. Even things like what is called preeclampsia or pregnancy-induced hypertension is a very serious complication that can happen in pregnancy. People could start have seizures and the blood pressure go up high, and they can start damage them kidney and all kind of things. And vitamin D deficiency is associated with that. And to tell you the truth, when I was doing obstetrics, I hardly do any of that now. I never know that. So almost every pregnant woman, really and truly, I'm putting it out there now if any doctors on the site, and I'm going to send this out to all of the doctors who deal in obstetrics to tell them that all the pregnant patients need to be supplemented with vitamin D for themselves and the baby. All right? Things like Alzheimer's and Parkinson's disease and mental issues like schizophrenia and autism, all of them are higher in people who are vitamin D deficient. Right? So vitamin D deficiency touch on just about everything. Cancers, all the common cancers like breast cancer, colon cancer, prostate cancer, those three, the amount of people having them things, and they are higher in people who are vitamin D deficient. So I'm putting it out there now. Anybody who have any kind of cancer really should be taking supplementation of vitamin D, and not the minuscule level. I personally take 6,000, for those who want to know. I take 6,000 international units of vitamin D every day. And the last time I checked my serum 25D level, it was 59 nanograms per mil. So I am way up in the required range, or what we call satisfactory, is between 30 nanograms per mil to say 69, 70. I would put it there. Some of the authorities have it lower, but to get your immune system kicking, it should be above 30 and probably more up to 70. I am at 59 the last time I checked. So the things I'm doing, and I try to every Sunday morning I work for hours in the yard, carrying water around and different things just in my shorts. But at least on Sundays, I spend at least 2-3 hours out in the sun. Right? So hopefully I will be getting a 2,000, probably a 3,000 international units of vitamin D made naturally, but I am an old man and the fat in my skin probably not enough. So when the substrate lower, you really need to spend more time. So I supplement too, because I know I want to reduce my risk of getting cancer and all them other things. So everybody with breast cancer and colon cancer and prostate cancer, particularly those three, which are very rampant, they need to be on vitamin D deficiency. Right, because the vitamin D is you see how the cancer cells generate new blood supply. It is anti-angiogenesis. And the vitamin D promotes something called apoptosis. It means programmed cell death, right? Because the cancer cells is like they're unregulated. A normal cell program to divide like about 26 times, and then it become an old cell and it will die, and something named autophagy clear it out of the system. So you get rid of the dead things, them are what they call them senescent cells. Get them out because they are pro-inflammatory and cause inflammation. So when you clean them out, especially like remember we talk about fasting, intermittent fasting, and that kind of thing. When you're doing that, you clear out all them old sick cells when not working, but creating inflammatory thing. Vitamin D facilitate those cells dying, and we're getting rid of them.
Okay.
You follow all of that?
Yep.
Yeah, vitamin D is crucial. So things like even pregnancy, right? People who have really low levels of vitamin D, it can affect them fertility. The miscarriage rate is higher, and it can affect the fetal development, and programming the fetus to have a lot of issue, the autism and all them things that I mentioned before. You got that?
Yes, got that.
All
Someone
right.
was asking, Doc, in terms of the sun, you mentioned the sun earlier. Does it matter when you get the sun, morning sun, midday, late evening
When the sun overhead is the best time. So between 10 o'clock to about 2 o'clock is the best time. So I try to be outside between 10 and 12 primarily.
And that's the time they tell you to avoid the sun. They like get early morning sun or
Yes, I
late
think I
evening
don't
sun.
explain it already.
I know, yes.
Darker skin people don't have to worry about getting no sunburn and skin cancer.
Yeah.
The lighter skin people, even the Caucasians, can still go outside for 10-15 minutes and then put on your
They're
sun.
good. Yeah.
Okay. All right, let's focus now on the innate immunity. So I'm going to rehash some of the things I said already. The two major cells in the innate immunity are something called macrophages and something called dendritic cells. So the vitamin D3, I said before, in the liver and some other cells too, can make it into something called 25D. The 25D is what go to the kidney, and the kidney make it into 125D, the activated form. But the macrophages can also do it. It have the enzyme. All right, some people might want to know the name of the enzyme. These things are long names. You don't need to know it. But it is called CYP 2781. Don't ask me what CYP means. It's long words. All right, so that enzyme will convert the 25D to 125D, which is the activated form, which the macrophages can now secrete out into the bloodstream, and that now will affect other cells of the immune system. The dendritic cells can do the same thing like the macrophage. And when they secrete this activated form now can come and upregulate, because your neutrophils are the ones that nearly fight off bacteria. They are the front line. They're very important for fight off bacteria.
Okay.
You have some other cells named eosinophils. They're in the tissues and things. They're very important to fight off bacteria and any pathogen really. Basophils, they are out in the tissue too. All of these are called myelocytes. They are myeloid cells. So monocytes basophils, eosinophils, macrophages are called myelocytes, right? They're making the bone marrow. And with the vitamin, with the 125D, they're upregulated and much more efficient in counteracting the infection. All right? There is a cell called the mast cell. You don't want to stimulate that too much because that one is the one that produces something named histamine that can cause urticaria and allergic type reaction. Okay?
Okay, that's why you take antihistamine. Okay.
Yes. There is an older form of defense in the immune system called complements. These are some proteins that before earlier, when in the early part of evolution, complement was more important as an ancient form to kill, bacteria and them things. But nowadays, the myeloid cells, like I just said, mast cells and neutrophils and eosinophils, basophils, macrophages, dendritic cells, more important now. And the T cells and the B cells. But the complement also get activated with vitamin D. All right. So that is what you call the innate immunity. You don't have to be exposed. All these things, they are working that when whatever bacteria or virus turn up for the first time, these are the things that are activated in somebody whose immune system is competent in order to protect you. You hear me?
Yes.
Let's just go to like the first talk we talked, it was on cervical cancer. And we were saying like
Right.
cervical cancer is due to a virus called human papilloma virus, right?
Right.
The human papilloma virus, remember I said that it don't go into the bloodstream. So it don't get exposed to what is called the reticular endothelial system, the thymus and liver and bowel and all them kind of things, all right? So the whole life cycle of the HPV is within the mucosa of where it is, in the vagina, the anus and the cervix, in your mouth and the lip, tongue, throat, larynx, and things like that. So is this innate immunity that will clear HPV. You get that?
Okay, yes.
And remember, I said that the HPV, you can have it 100 times and clear it 100 times. You don't develop no memory for it because it don't go in the bloodstream. So you don't get no memory cells, no T memory cells and T helper cells and plasma cells and things like that. Okay. And I was making a point why it was important for people to go and get the HPV vaccine. When you get the HPV vaccination, you turn on the T cells and the B cells. And like the T memory cells will circulate in your system like for the rest of your life. Okay?
Okay.
Next time it show up, these things get activated because this is the primed up immune system and neutralize the virus. You with me?
Yeah.
All right. So this is what you call the adaptive immunity. Cool? So the cells them in the adaptive immunity are what we call natural killer cells. These are some ancient cells too, right? So a lot of times, they are at the front line. They are the front line. Natural killer cells. And then you have some called gamma delta T cells. They evolve a little bit later. But they are fairly primitive cells too early in our evolution to protect us. So these kind of things in lower animals too, right?
Right.
Yeah. And then, so these are the frontline things. Then you have other T cells that come after, evolve after. There's a whole host of them. I will just mention some names. You have like TH2 and Treg and TH1 and TH17. You don't have to try and memorize this. And then you have B cells. The B cells are the one.
That's okay. Leave him. It's okay. Yeah.
All right, that's my grandson.
Yeah.
The last one. So the B cells are the ones that produce the antibodies. All right. So these are all part of what we call the adaptive immunity. Vitamin D is very crucial because vitamin D oftentimes what it boosts up things like the natural killer cells, and it boosts up things like the gamma delta T cells. But after you kill the thing, you want the inflammation to dampen down so you don't get over prolong and then start kill normal cells, what they call innocent catalysis. So the vitamin D now will tone down most of these other T cells. The TH2 and TH1 and TH7 and all those things. You get that?
Yeah, which is similar to what you described with what happened in COVID, with the excitement of the immune system,
Yes.
the
And
cytoketones.
it will
Yeah.
also decrease the plasma cell. The plasma cell is a cell that produces plenty antibodies. It decreases
Mhm.
plasma cell activity, so we decrease the antibody secretions and decrease the memory cell differentiation. Because the memory cell is what differentiate to become the plasma cell will boost the antibody response.
Antibodies, yeah.
All of that, the vitamin D will tone down, because all of these cells have vitamin D receptor, and the 125D will lock onto this receptor, and it will go into the nucleus of the cell and produce certain things that don't regulate these things, or if early in the infection, upregulate certain things. You get what
Okay.
I'm saying?
Yeah.
All right. So like, for instance, all right. So this is like vitamin D have a dual activity. Right, yeah. But some people say it's a double-edged sword. But most of the time when you say double-edged sword, it means that something have good
And
things
bad.
and bad things. But
You're
it's
right.
not with vitamin D. It don't really have no bad side. But it's saying double-edged in this means that it can tone up the immune system early in the thing to sort it out. And once we sort it out, it don't regulate things. You get that?
Okay. So the
Okay.
down regulate is good though.
The don't regulate is good after you
Right.
take out the pathogen.
After, okay.
Yeah. All right. That wasn't happening in the COVID. Hence
Mm.
the sequel of the the damage to the lungs and people drowning and things. And in fact, there is evidence that people who got COVID and who had vitamin D, right, at a sufficient level. I know I got it at least 3 times when we know for certain, because we did the swabs and it was positive. And I never get sick.
Okay. Oh, you had it, but you didn't show the symptoms.
Really. And if I feel like a little runny nose coming on, a little sniffle, or a little sore throat look like it want to come on, I go from my 6,000 units straight up to 12,000 units. And usually by 2-3 days, whatever was coming off disappear. The runny nose just go away and the sore throat go away.
Okay.
You hear what I just said?
Yes, I heard that.
Yes, but a lot of people, even doctors and even educated doctors, will tell you
We're
that
not.
that's
That's
very
too
high
much.
level and
That's
you
too
get
much.
toxicity. It's very, very difficult to get to toxic levels. I was looking at something, they were saying like the Maasai people from Kenya and Tanzania and them place. Because they're out in the sun like 12 hours a day, tending to them cattle and doing other things. And they only have like a loincloth and things like that and them spear are what they're walking with. So they're soaking up very plenty vitamin D. I mean, from the sunlight, even though they're very dark. And there is when they check these people, their vitamin, that the 25D levels, way up like up to around 150.
What?
Yeah, 150 nanograms per mil, and then I'm a toxic effect. But the immune, like the body have a defense mechanism to shut down the production naturally, like from the sunlight, because it's like you can't go over about 150.
Wow. From the sun. Okay.
Like lifeguards and thing in America, who during this summer and thing, them outside, plenty without them shirt on, and them depend them, them soak up plenty, and they light skin. In America, we're talking about them people in Miami and all them kind of things. And when they check them, plenty of them up to 100 and 110 nanograms per mil.
But doc,
without supplementation.
yeah, but I'm gonna say maybe it's the supplementation is the worry when it comes to the toxicity and not because
this is without supplementation.
no, I'm saying the doctors who are worried about toxicity, maybe they're talking about the supplements and not so much from the sun. You can get as much from the sun as you say, and the body regulates it.
Yes.
But could it be that the man-made supplementation is where the worry is?
No, even with the supplementation, they will say you have to be taking like about 100,000 international units for like about 8-10 weeks straight.
Oh, wow. Okay.
You know, to go up there. Because what happened, there's a protein, which is the vitamin D protein binder, globulin, with transported in the blood. So most of the vitamin D in the blood is attached to a protein, right? So it's not activated.
Okay.
You see what I'm saying? And it's the free vitamin D which is really the one who doing things.
Okay.
Remember the last time we were talking about polycystic ovary syndrome?
Right.
Talking about testosterone and sex hormone binding globulin, which was
Right.
locking up the testosterone and the estrogen.
Right.
So the total testosterone is far more than what is the free testosterone. But is the free testosterone is really biologically active, right?
Okay.
So the same thing happens with vitamin D. It's very difficult to get to levels to cause toxicity that will start to cause what we call hypercalcemia and all of the problems that come with hypercalcemia. Right?
Okay. Okay.
Yeah, so even people who working with this for 30, 40 years, I was listening to a discussion with some of them, and they said they never see a case of vitamin D toxicity.
Okay.
Yeah.
Okay, so hear that, folks. Don't be afraid to take your vitamin D supplementation. Help to ward off all kind of cancers, prostate, breast, cervical, all right, and
Let
just
me
strengthen
just
the
go
immune
back a little
system.
bit now. So
Yeah.
I want to stress on the importance of the activated macrophages and dendritic cells. So if you have a pathogen, let's say like TB, right? Those bacteria, I mean, the mast cells will come normally and start to what they call it phagocytose them. It come and it put out some little arms and engulf the bacteria and form a little vacuole inside of the cell called in the cytoplasm, and it produces, you have certain proteins that will kill the bacteria. Let's not get into it. These are what you call antimicrobial peptides, and they have all kind of big names. I don't want to get into it. The macrophage will do this naturally, and the dendritic cells will do it. Monocytes and basophils and things will do it too. But in the presence of the vitamin D, they get upregulated, and this thing is much more efficient. Much more efficient. So the macrophages will pick up the 25D from the bloodstream if you have enough vitamin D to make it. And once it comes into the cell, the vitamin D receptor, it will lock onto the vitamin D receptor, and you produce inside of the cell the 125D. The 125D receptor will now enter the nucleus, because that takes place in what is called the cytoplasm. I don't want to get too technical, but it's going to the nucleus. And this now will activate certain genes that will cause the production of the antimicrobial peptides and them. This is, amino acid chains were like toxic to the viruses and toxic to the bacteria. So it makes the cell, the macrophage and dendritic cells and monocytes and basophils far more effective than the ones that not in the presence of enough vitamin D. You have that?
Have that.
All right. And then after this acute thing, you take out the pathogens, the vitamin D will then start to shut down the reaction to prevent too much innocent bystander lysis. Okay?
Okay.
All right. I was looking at a study. There was a meta-analysis. A meta-analysis, I will say before in some of the other lectures, is when you take a lot of studies and put them together and you analyze them. So you can get like one big study. But the power of that big study would be more, because if you have 10 study with 10,000 people, then you have a study now with 100,000
people.
Yeah. All right.
Okay.
So if it's showing certain things, is reduce the chance of bias, and that certain conclusion would be a mistake or by a chance occurrence, right?
Yeah, because you have a wider pool.
Analysis looking at studies with vitamin D, and I just write out a couple few things out there. And one of them, vitamin D supplementation was very efficient in decreasing respiratory infections, especially in those who were vitamin D deficient. You hear that? So if you're vitamin D deficient and you get supplementation, it's very effective in decreasing your risk for getting, respiratory tract infection. That is cold and flu and COVID and things like that.
Right.
The people, when I said in those who were deficient, there was there was some high levels of reduction in those who were vitamin D sufficient, right?
Mhm.
There was reduction in these things too, but far lesser percentage. Okay.
Mhm.
All right. But they were saying that if you even have a daily dose, all right, in this study too, it showed that taking a smaller daily dose was better than taking a big bolus dose like once a month. Because some people
Okay.
will take like 50,000 units once a month. The protection they get is not as good than if you're
Mhm.
taking 4 or 5 or 6,000 units daily.
Okay.
So that study showed that. All right. So they were saying that the vitamin D receptor, as I said before, is expressed in almost all tissues of the body. And this, when it goes into the nucleus, it can regulate as much as 1,000 genes.
Wow.
So if you have a molecule that regulating 1,000 genes to do different
Wow.
things in the body, that is
Wow.
a very crucial molecule,
Right.
right? And nobody should be deficient in this. Because
Yeah.
you see all the other things I just mentioned about hypertension and SLE and schizophrenia and autism and cancers and all kind of infections.
ADHD and all them
Yes,
things.
all them kind of things affected when you're deficient.
Mhm.
So it's a little historical thing now. Historically, I think I mentioned it before. They
Mhm.
discovered that cod liver oil, it was used and it was effective in treating TB far back in the 18th and 19th century. But with the discovery of antibiotics about 100 years ago, you know, this kind of followed for use because you're using antibiotics now, which a bit more effective. You get that?
Yeah. Mhm.
All right. But they were using the cod liver oil. They know it worked, but they didn't know why it was working. We now know that it was the vitamin D.
Yeah. When you're small, your parents give you a lot of cod
Yes,
liver oil,
I
and
used
you
to
don't
get
want to.
cod liver oil when I was small too. And I used to
Yeah.
play in the dirt. The outside cellar used to play on the deer. All them children now, like my grandson who just passed there. You know, nowadays now it's almost like the parents don't want them to play no dirt, no go on the cellar, you must not go outside, blah, blah, blah. Right?
Mhm.
So
Mhm.
our immune system was primed up so much by being out in the sun so much and so much dirt, all kind of antigens around us. You know, where we're presenting to we innate immunity, and then we're getting, so we're boosting up our adaptive immunity. The people
Mhm.
that know inside all the time, and everything is the set of hand washing that we were having, and you must wash your hand
Mhm.
and wash your hand, and everything like that. All them things reducing the amount of antigens that you're presenting to your immune system to program your immune system to deal with them. You get that?
Yeah.
All
Mhm.
right. So let me just touch on this dual thing again with the vitamin D. So we have vitamin D, the protective thing that I'm trying to say that everybody should be doing. We should have supplementation, and this will be preventive medicine, right? But you need to be doing it all the time because you can't wait until you're sick. You have COVID and then you start take the vitamin D because it's a slow process for the liver to convert that to 25 vitamin D and for that to go into the kidney and other cells and to be converted to the active form. So it might take 2 weeks and you're dead. You understand? So if people supplementing, they will most likely reduce the chance of getting something. And if they get it, it will be most likely mild. They might be asymptomatic. Them oxygen saturation now go fall, so them now forget hospitalized, and then probably if people who not in the know might put you on the ventilator, and your chance of coming off is highly reduced. Okay?
Okay.
All right.
So prevention is the
Yes.
key.
All right. So we can use it to acutely treat the thing. So some of the studies during the COVID time that was saying that vitamin D wasn't effective. Is this what they were doing? And so a study out of Brazil, and there was a study from I think, can't remember, but there was one out of Brazil that was quoted plenty that was saying the vitamin D wasn't efficient. But what they were doing, people sick already in hospital, and they giving them vitamin D. But this might take like 2 weeks before you go and get your 125 vitamin D, which is the activated form. You understand what I'm saying?
Right, correct, right. So they were way gone.
people deteriorating hour to hour or day to day.
Yeah.
So if you do that, clearly it is like the study design was poor, probably because of ignorance. All right.
Yeah.
Or some people might have asked to grind and don't want it to show anything because they want the vaccine to come along and for everybody to be mandated to take the vaccine. I sound like a conspiracy theorist. So let me see on this. Let me go to it. The 25D, which the liver produce. If you give that, right, that is called, another name for that is calcifidiol, right? That can be given to in oral form. So when somebody's sick already and come to the hospital, if we give them calcifidiol, that absorb quickly and rise up in the immune. So you start get your 125 vitamin D within 2-3 hours. That is faster than even IV antibiotics. You hear what I just said?
And that is only administered in the hospital?
I don't know if we have it in our hospitals here, but we should. I hope somebody listening to this. In fact, when we get this thing, I will send it to some people at ministry level or that kind of thing. And hopefully they will listen. But a lot of time we send things and people don't like to listen. So the vitamin, the 25 vitamin D, every hospital should have it, and especially like the intensive care unit. So if people come in sick from flu or cold, or them still have COVID-19 is no endemic in the place, you know. Mean endemic mean it's in the system, right? And you have people out there still badly vitamin D deficient. So them probably still not making antibodies or activated T cells to protect them against COVID. So people can still get COVID and still dead from COVID if you're very severely vitamin D deficient. If somebody like that get us admitted to hospital, the oxygen saturation low, low 90s or the 80s, and them come, you might still have people like that going on ventilator. Nowadays, they might give them, bolus dose of vitamin. No, dexamethasone, because we know that would dampen down the inflammation and thing. But in addition to the dexamethasone, I am advocating now that we should be giving calcifidiol, which is the 25 vitamin D, because that will quickly, all the immune cells, them and the kidney and thing, and so we convert that quickly. This is the fast process to activated vitamin D, which is the 125 vitamin D. So we bypass the slow process in the liver. You get that?
Okay. I was trying to capture the name properly.
Forget about the name. Just call it 25 vitamin D. That will be easy to remember.
25 vitamin D. Okay.
Yes,
So
and
for
that
somebody
is
who's
in the liver.
answering, that's the name.
And the 25 vitamin D go to the kidney and other tissues and convert it to 125 vitamin D. Just call it that.
Right, 125 vitamin. And that's
Yes,
the one you need to test
125
for.
vitamin D is the activated form.
Okay, and that's the one you need to test for, right?
The 25 vitamin D. But that is very slow to make.
Okay.
From the sunlight and the liver. Okay? So you use that for prevention. You can't use that as treatment.
Okay.
So we have vitamin D here as a supplement or a nutrient for the prevention. And when you use it in this form, the 25 HD, the 25 vitamin D, it is used like a drug. You understand?
Okay.
And this drug, I am putting out a hypothesis that it may be even better for sepsis and thing than IV antibiotics, because the IV antibiotics take about 5-6 hours to start working. And if you take oral antibiotics, it's even slower than that. You understand? So if somebody in a hospital setting, ICU setting, get the calcifidiol or the 25 vitamin D, immediately within a short time, the immune system will get activated, because the 125 vitamin D is made quickly within a couple hours, and you will sort out yourself quickly. Oxygen saturation coming up, and we'll put that to rest. And
But this is
prevent
but this is prescription and only administered in the hospital.
that to be hospital. Yeah.
Yeah.
Good.
So people, you can ask your doctors for this when you get into hospital. This
Yeah.
information is, no, I'm saying it's so important to have this kind of information because you can advocate for
I am going
yourself
to send. I am
in
going to send this.
hospital.
I'm going to send this to some of the doctors. Them like say St. Clair. The
Mhm.
intensivist in St. Clair is a very bright guy. I was talking to him about this about a week or two ago. But I'm going to send all this information when we put together to him. So if
Yeah.
it's not available in Trinidad, this is something where them have to lobby now the ministry start bringing so that the hospitals have this stock, because it can be used in this form. The vitamin D can be used like a drug, and it's very effective.
Yeah.
And
Good.
I have never heard any communication from the Ministry of Health, right, as a public health information thing, encouraging people to be vitamin D supplemented. I personally never hear it. You ever hear it?
No.
Which is crazy. You understand?
No, they don't want us to be in the know, and that is why we're
Well, I
removing
don't know.
gatekeeping, no
I
gatekeeping.
think it's more ignorance.
That too, that
So
as well.
that's what we do here now, because I send out your thing to several doctors. I hope that some of them listening.
Yeah.
And if some of them pass it on to people, they might listen to them if they don't want to listen to me. I sound
Right. Exactly. The public can advocate for themselves. Yeah.
All right. So I am saying, let me go over that again because it's crucial.
Yeah.
Daily supplementation is essential, right? Because that will stimulate your innate immunity, and it will prevent or limit infection, particularly respiratory tract infection. Okay?
Yep.
All right. So that is one rule. It's another dual role of vitamin D again. So that is vitamin D as a nutrient and as a preventative. Then I just talk about vitamin D as a drug. That when people sick already, if you give them the 25 vitamin D, it will make vitamin D 125, which will quickly, bring things under control and stimulate the adaptive immunity. So you're bringing all of your T cells and B cells and all them things. Okay?
Yep.
All
So
right.
people, it's very crucial, given what we're hearing, what's going on with more viruses, to start putting ourselves, well, I would say the nutrient and the preventative mode, those two right now.
All right. I
Yeah.
have plenty more, but it get more technical. I don't think I probably should go on to them. And I think I cover most of the thing already.
Yeah.
Let me just mention one and two little things that
Mhm.
people might want to ask.
Yeah,
People
right.
might ask some things when are really so important. So
Yeah.
they might want to ask the difference between vitamin D2 and vitamin D.
Right.
It's just one little thing. It's like the same thing, but all right, let me tell you, the chemical formula for D2 is C28. That means it have 28 carbon atoms. H44, it have 44 hydrogen atoms, and it have a O. So, right.
Oxygen.
Yes, and D3 is 27 carbon atoms. So it have one less carbon. It have 44 hydrogen, the same as D2, but it have oxygen too. So it's very similar. It have one less carbon atom, and that is the vitamin D2, and carbon 24, it have what is called a CH3 group, a methylene group. Whereas the vitamin D3 have a OH, no, have a hydrogen, sorry.
Okay.
Get
So
that?
why they didn't just make one? Why they make two?
No,
Diversity.
the vitamin D is made in mushrooms, right?
Okay.
And the D2 and the D3 is mainly from animals,
Oh.
right?
Okay.
Plankton and them things can make them early in the food chain, but fish eat them and this and that and thing and so and like chickens and all of them, like the fat solid, like in the yolk at the egg, you will have some vitamin D and K2, all of the fat soluble vitamin. Egg is like a perfect food. And you hear people talking nonsense, they must take out the yolk and I'm going to use the white and the white have mainly just albumin and some other proteins like that. But the
Mhm.
yolk have all of the fat soluble vitamins A, D, E,
Mhm.
and K, and it have whole heap
Right.
of minerals too, and it have all of the essential amino acids and all that kind of thing. So it's
Mhm.
important. Egg is a very vital thing. I use plenty of egg every day.
Okay.
So it's so much source of vitamin D I get in. I supplement in 6,000 units. Plus me eat plenty egg. Every day I eat at least 2-3 eggs. Sometimes I go 4. Right? And on Sundays, I try to spend 2 to 3 hours outside working in the yard. Okay?
Yep.
So I next year, later this year at July, when I'm going to check my serum levels that are the 25 vitamin D, I want it to be near 100.
Okay. I need to check mine. So people take a note of that. Make sure check your serum levels.
All right. So the vitamin D2, it is stored in the liver and in the fat. D3 too.
Mhm.
All right. A dietary source for the vegans and vegetarians, as I said before, you can get it in mushrooms. Okay. So them have to eat up plenty mushrooms. If you give a bolus dose, same bolus dose at D2 and D3, the D2 will fall quick, much faster than the D3. So the D3 hang around in the bloodstream much longer. So that is the preferred form for supplementation. All right. Now you will get severe. When I say severe deficiency, that would be if people have less than 10 nanograms per mil. Write that down. Less than 10 nanograms per mil. So if people go and ask them doctor to check them vitamin D level, like I saw a lady just a couple of days ago who was down to below that level.
Repeat, Doc. Repeat what's the level? I was letting somebody in.
If you're below 10 nanograms per mil, that is severe deficiency.
Wow. Okay.
So I saw a lady just a couple of days ago who's very, very dark. Right. And she obese too. And her GP is a sensible guy. And he had do some of the certain things. He did some of our inflammatory markers and our hemoglobin A1C, and he also checked our vitamin D level. And it was below 10.
Okay.
So I started her immediately. And 10,000 international units at D3 to take every day.
Wow.
For the
Okay.
next 8 weeks at least.
Okay.
So I told her in 4 months, we will check the thing again, okay?
Right. Okay.
And she can lift up out of that to reducing her risk to get flu and cold that can get bad, or even some COVID we're hanging
Cancers.
around out there, or all kind of bacterial thing.
And
Plus, I
cancers.
said to you before that people like this, people who have the metabolic syndrome, remember we talked about that last time. People who have the metabolic syndrome, they're suffering from chronic inflammation. Vitamin D is very effective, as I said before, in toning down inflammation because it can shut down the cytokines. It shut down the macrophage and neutrophils and them and mast cells and them. We're secreting the cytokines, which are some of them, like tumor necrosis factor, interleukin-1 and interleukin-6 and things like that. All right, these are pro-inflammatory cytokines. Remember that from last time?
Yep.
All right. So vitamin D crucial.
Inflammation.
All right. So there's a daily requirement that some of the ministries them across the globe. I'm just going to give you some figures and show you how low them is. Like in America, they're saying, healthy adults should get 2,000 international units per day, and that you shouldn't go over 4,000 international units. Those are all right levels, especially, if you're not, if you have the metabolic syndrome and you're not very dark and you get some sunlight and you eat fatty fish and all that thing, that would be okay. They're saying that infants should be getting 400 to 1,000 international units per day. So that could be by fortified milk if you're giving them that. But better yet, the mother should have a good level of supplementation. I would give them 6,000 international units a day. and that will pass through the breast milk to the infant. All right?
Okay.
All right. Because everybody should be breastfeeding. Remember last time we say it would be ideal for people breastfeed at least a year and preferably 2 years.
Exactly. Right.
All the benefits the baby going to get, plus the mother getting big time benefits.
Benefits.
So the longer the baby breastfeed, the higher the prolactin levels will remain, and the prolactin will antagonize estrogen. Remember all of that talk?
Right.
Yeah,
Yeah.
so all of these things linked up, right?
Right.
So
Yes, I
people
just
probably should go back and watch the whole series.
right.
Podcast what we have been doing, because right from the first one, you hear certain teams coming through, right? It link up.
Yes.
We talk about ovarian cancer. Remember we were talking about the people
Yes.
never breastfeed or never get pregnant
Right.
and never use the
Prolong, yeah.
overweight, and you understand?
And the prolonged exposure to estrogen, yeah.
All of that. So
Right.
all of these people who have to prevent all them things, vitamin D coming at the mix too, along with getting pregnant at least 3 times and breastfeed for a year or 2, exercise, eat a ketogenic or a low glycemic index diet so you can keep a kind of normal body mass index. You're all of it tie up, okay?
Right.
All right. So for children, not breastfeeding now, bigger children, them saying that they should have 600 to 1,000 international units a day. I'm telling you, from what I know from reading and checking these things, those figures are very low. So you see my grandson who just passed here a while ago? You saw my grandson who just passed?
Yeah.
He light skin, he much lighter skin than me. But I encourage him, and even the bigger one too. So Sunday morning, when I working in the yard, moving water from like my fish pond for water, you know, I we taking the water from the filter that are like steroid for the fruit trees and my flowering trees and all them things. So him have a small bucket and I make him walk up and down with me. Just in him short pants, right? And helping me in the yard. And he love it. He like, hey, grandpa. But him so I'm gonna tell him, you know, like me tell him about vitamin D and why him shouldn't have a certain
Wow.
I mean, at his son and thing. So him is 6 years old and him understand what I'm telling you here.
Right. And you see, we spend more time indoors, as you say, everybody on the computer, we're inside now afraid of the sun. And that is why we're having so much incidence of this. Because when I was younger, you're outside playing most of the time, you didn't have anything to occupy you inside.
Yeah.
Yeah.
All right. So the last point I want to make right here, so now, is when you go and check, when your doctor asks, you ask your doctor to check your vitamin D level, and then go and check your 25 hydroxy D. It will be ideal. I am putting this range now. Some of the people have much lower. I am saying to you, it should be somewhere between 30 to 60, or preferably 70 nanograms per mil. Write that down. It should be between 30 to at least 60 nanograms per mil. If you're up there, so you're good. My last one was 59, but I tell you, I want to get it to 100 the next time. No, there is no evidence I could find. That might come out, but because plenty of people looking on this now. But right now, I can't tell you that having 100 nanograms per mil is more effective in boosting the immune system and give you more protection than having 60. You hear me say?
Yeah.
All right, so the 30 to 60 may be just as good as 100.
Okay.
But probably in a year or 2 or 5 years, I will know that information. So once we know it, I will let you know.
Okay.
All right. So let me just finish off with one last thing again. I'm repeating myself plenty, but repetition is good.
No, it's good.
And to put it into a part of your brain named the reticular activating system. Once it's going at the reticular activating system, you hold that memory.
Okay.
Right? Yeah. So I
Learn about the brain.
put all of this in a reticular activating system. So when we're ready, we can
That's the frontal lobe.
All right. So the 125, the big name is dihydrocholecalciferol. A simpler name is calcitriol. 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 Calcitriol is the same thing as 125 dihydrocholecalciferol. But I'm saying to you, just remember it as 125 vitamin D, right? That easy to remember. 125 vitamin D.
Right.
The formula for that is carbon C27 H44 O3. So you see how similar it is to the vitamin
D2.
D3.
D3, yes,
Yeah,
D3.
D3 have 27 carbon, 44 and
44
one
and
oxygen.
on oxygen, yeah.
But this one now of 3 oxygen, and the 3 oxygen is that the kidney put on 2 what is called OH group, hydroxyl group, and it put 1 on carbon atom 1, and it put 1 on carbon atom 25. That's why it named 125
Okay,
dihydroxy. All right,
okay.
that's what it means. It's 2 OH group that the kidney and the mast cells and then put onto carbon atom 1 that is in the A chain, and then on the tail it put on a OH group and carbon atom 25. That's why it named 125 dihydro
Okay,
polycalciferol.
sure.
Okay?
Okay. Take me
And
back to
this-
chemistry class.
Yeah.
Taking
All
me back to chemistry class.
Yeah, this is the active form. I want people to know that this is the active form. So what we measure in the blood is not the active form. And I know somebody will come and say, then why we not measure the active form? That don't really make much sense, because that is very transient. It uses up fast, especially if you have an infection. And it can even be elevated in somebody who fighting an infection, even if the people deficient, because the other hormone like parathyroid hormone and all them things will be very high, trying to absorb enough calcium and things, and so in the vitamin D deficient state. And the parathyroid hormone then will be producing some 125, right? Which will be helping you. So if you check 125, it might even look normal or high in the bloodstream when you're overall very deficient. But every time you use 125, it's like a bullet. It's like a bullet where you're using to kill the bacteria or kill the virus. And you can only use it once. You see that? What I just said?
Yes.
Let me go over that again.
Yeah, go over.
The 125
Mhm.
vitamin D is like a bullet where the immune cell firing to kill the bacteria or the virus.
Mhm.
So when you fire a bullet, it is spent, right?
Right.
You need more bullets. You need a next magazine. After you've done one clip, you need another clip to put in, right?
Mm-hmm.
Yes. So the people them who deficient in vitamin D will run out of bullets.
Mm-hmm.
You understand that?
Yep, yep, yep.
A lot of people don't
There's no
understand.
defense. They don't have no defense, really.
So you will have like an obese person have a whole heap of vitamin D trapped in the fat cells, are locked on to the carrier protein, right? So them free D3, the free D3 is relatively low. So they will form relatively low 25D3, 25D. And if the 25D is the substrate to form the bullet, which is 125D, right?
Okay.
So get an infection and you're low, you have some reserve, I think there, boom, 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 boom. Your macrophage and dendritic cells and your T cells, T natural killer cells and things, use up your bullets. And then what happens? You know, have the substrate.
No defense.
All right.
Yeah.
So that is a serious point me just make where
So Doc, if you're obese then, and if you're taking the supplements, it will just continue to be trapped in the body. So it makes sense to lose the weight first.
those people, I would put, like I tell you, I take 6,000 plus the other things there. But my body mass index is 23 kilogram per meter square. The lady when we see this week, I think what we work it out, it was 44 or 45 kilograms per meter square. So it don't make sense. I put her up on a low level, so I put her on 10,000 units. Yeah.
Okay.
Daily.
Okay.
And I want to see her back. She should use that at least for 8 weeks, but I tell her to use it for 4 months. So that will be 12 weeks, and then we will check it again. And if she's in a good level at that point in time, no harm, no in dropping her to about 5 as maintenance, 5,000 units, right? Or 6,000. Cool? But if she do the other things that I ask her to do, ketogenic diet, a starter on glucophage too, and are weaning her onto it. Remember last time we talked about you wean onto it? So
Right.
somebody overweight, they need to have about 1500 milligrams of metformin daily. It help them to lose the weight and it at that level it's anti-inflammatory. It also slow down the rate of aging. We must talk about this for a whole podcast by itself. We talk about metformin, okay?
Okay, all right.
I'll get in to explain to people about what a telomere is from the end of
Right.
the chromosome and slowing the shortening of the telomere as we age. We slow down the rate of aging. It also switch on a gene, something named AMPK, right? That will facilitate killing cancer cells, all them kind of things. All right.
Okay, yeah.
A crucial piece of information where I'm telling you, most doctors don't know because I talking to people and I see what happen with my patients when I put them on it, and as they go to hospital and them checking what drugs them on, and them say, you're taking glucophage 3 times a day, you're diabetic, and they say, no, we're not diabetic. So why you on that? Well, Dr. Pottinger put me on it. You're not diabetic, he put you on it. He's a jackass. We're going to stop it. You understand? And this is very, very frequent because cancers me deal with. Most of my patients, them are cancer patients who need to be on the thing.
Yes.
So,
okay, Doc, yes.
You understand what I say?
Yeah, we'll have a conversation on that next, because it's crucial,
We'll talk about that. So maybe
Yeah, because we're at 7:30 now, so
I have to finish. Let me finish it.
Yeah.
All right. So the point I want to make is that this activated vitamin D is a hormone, it's not a vitamin.
Yeah.
It is made primarily in the kidney, but it can also be made by the placenta. It can be made by the spleen. It can be made by the lungs, and all of them immune cells I talked about before, particularly macrophage, neutrophils, dendritic cells. Yeah. No, this 125, it need adequate amount of potassium. That is a mineral, right? For it to function good, for it to be activated. Because everybody, for some reason, deficient in magnesium. You might be making plenty 125D, but the majority are not getting activated because it need magnesium.
Yeah, somebody asked about that, so that answers your question.
Magnesium, and it work in the our partner is like a tag team with vitamin A. But D is the general, okay? So magnesium is needed to activate vitamin D. Magnesium is the 4th most abundant mineral in the human body. After calcium, potassium, and sodium, okay?
Okay.
And all of them important, including sodium. I tell you, I think I mentioned it before, that, you know, from long time, before me even come into medicine, I always had problem with this advice not to use salt, because salt will make your blood pressure go. And the idea is that if you're taking salt, the salt going back up in the bloodstream, and the salt going pull water with it along what they call the osmotic gradient, and hence increase your blood volume and increase pressure, put more increased pressure on the walls of the vessels and make your pressure go. And to me, that was always a jackassness, because if somebody have your what they call your kidney working good, your lungs working good, your skin working good, it's difficult to change. These are what you call homeostatic mechanism. It's difficult to change your minerals and all them things and all, like the pH of the blood. So if your kidney working good, the kidney will excrete the sodium. You understand what I'm saying?
Yes.
Sodium. When you're sweating out sodium, you ever see when you sweat plenty or your shirt and things start to white and thing?
That's
And
salt.
sodium chloride, you know, precipitate out in your shirt, right?
Yeah.
So, you know, and it's just over about the last 15, 20 years, you see it creeping into the literature, where more and more people are realizing that was a stupid advice. And salt now make nobody get hypertensive. Because the most of the people who are hypertensive is the chronic inflammation. when we talk about the
Okay.
metabolic syndrome and vitamin D deficiencies, these are the things that are causing it. All right.
Yeah, because I've seen that where you cut out salt, people cut out salt and they still have hypertension. They doing
Yeah,
salt
it's
for a
a
whole week.
nonsense.
And then when they go to the
I don't tell nobody. I don't tell nobody if you avoid salt.
yeah,
Because
but when you go to the
especially the people who doing the right things and exercising plenty and sweating plenty, you
they need
need
it.
to replace your salt.
They need it, yeah. Because
Yeah.
when you go to the hospital, the first thing they do is to put you on drip, which is salts, really.
Yeah, you get asthmatic saline, which is
Salt.
0.9. What them call it 0.9 saline. Normal saline they call it. All right.
Yep.
So I think I say enough for the day.
Yeah, there's a question somebody had. Let me ask you about the D3 and the D25. Can they be taken together?
It's not necessary.
Okay.
The D25 is to use as a drug in a hospital setting.
Okay. And if you have arthritis, for example, D3 is good for that
so
as
if you
well?
have your arthritis, you supplement with your vitamin D every day, and you will have enough of the 25D. And if you have enough of the 25D, you will have enough of the 125D. All right?
Okay. Somebody asking about eggs giving heart
It
attack.
should be supplemented with D3.
Okay.
And I would have say 5,000, 6,000 international units daily. Now,
Okay.
I know somebody going to ask about K2. Let me just touch on it.
Yeah, K2.
So it crept in a little over the last 10 or so years that K2 should be taken with the vitamin D, because if the vitamin D increase absorption of calcium, small bowel, and you want the calcium to go into your skeleton, your bone and teeth and fingernail and them kind of things, and not be deposited in soft tissues like your blood vessels. That is the argument. So if you get deposit in your blood vessel walls, it's make the vessel start get hardened. And if the vessel hardened and not compliant, it can't dilate and contract, then your blood pressure will start to creep up. Okay? So that's one of the arguments. However, I see a counter argument coming now, say it's not really necessary. If you eat plenty green leafy vegetables and eat a proper balanced diet, you will get enough vitamin K and you will have enough K2, because these are needed in small quantities. I used to take 200 micrograms. You see how small?
200
Micrograms
mcg.
I K2 daily. And after a while, when we see the literature start to change, because I have plenty of it, I drop it now to 100 micrograms. So it will save me some money. That will last me twice as long. And when the amount that I have now finished, I don't think I'm going to buy no more. Or if I buy any, I might just buy the ordinary vitamin K, which much cheaper. But I eat plenty green leafy vegetables and other things. So I'm most likely getting enough of my vitamin K, and K1 and K2 that my body will need. All right?
Okay. Somebody asked if eggs cause heart attack. I don't know if that's a question we should even ask.
So it's nonsense. You see, they was demonizing the theory came out, the hypothesis that is high cholesterol is the primary cause behind heart attack and stroke. And it was a wrong hypothesis.
Yes.
And I don't know why, because it is well known now that it's not that. But it takes so long for the medical fraternity to embrace the fact that it's not cholesterol causing heart attack and stroke. The chronic inflammation and vitamin D deficiencies and them things far more important.
Right. I've seen literature now and the discussion around people having Alzheimer's and so on is because they don't have enough cholesterol because they were given antitassine to reduce the cholesterol, which your body really needs.
Because the cholesterol is a crucial nutrient.
Yeah, for your brain and so on.
Nutrient for your well-being, right? Yeah. What them call the myelin sheet that cover your nerves and them. Remember we mentioned about like the electric wire, and it have the rubber thing over it to insulate it. So
Right.
electricity now spark all over the place and setting fire and all them kind of thing.
Mm-hmm.
That cover over the electric wire and them is like the myelin sheet. And when people have an issue like multiple sclerosis, is an autoimmune disease where like the immune system attacking the myelin sheet. So it boring hole in the myelin sheet. So the insulation is not as good. You understand what I'm saying?
Yes,
You
yes.
have like electrical problems and things with them
Right.
people who have multiple sclerosis and damage. So
Yeah.
having adequate vitamin D will help in our situation like that. And your cholesterol must be good. Remember I mentioned that if your cholesterol too low, the body, you don't have to take in cholesterol at all, in your diet. Because the liver make cholesterol. Because it is very essential for so many things. I tell you that so much of your hormones and them, the testosterone, progesterone, cortisol, estrogen, vitamin D, cholesterol is the base for all of them.
Okay.
So this incessant aim and goal to push down cholesterol is not a good thing.
Yeah, Crystal.
Cholesterol get too low, your testosterone going to fall too.
Okay.
And dysfunction going to step in.
ED. So all the guys that are here, we have several men because I invited them. Somebody's saying here they have lupus and it's exacerbated by the sun, so they have to wear sunscreen and they can't stay in the sun too long. But
All
the
right.
doctor recently, no,
person-
one second,
that
doc,
person-
one second,
that-
doc,
Yeah.
doc, but 1 second, but her doctor put her on a large dose of vitamin D3. So she's currently on 4,000 IU and her levels vary between 62 and 66. And her primary
Very
doctor
good.
prefers it to be
So
higher.
very good. So, and that will kind of, as I said before, the vitamin D can tone down the inflammatory response, right? And she have a chronic situation, a chronic inflammatory thing. So with that level that she have at 60 something, right? Her immune system will be working better, and the T lymphocytes and them and the pro cytokines and all that kind of inflammatory cytokines will be toned down. So she will be more in remission rather than having bad flare up all the time.
Okay, that's what Phyllis doing.
So she have
Okay,
a sensible doctor.
yes, and he prefers it to be higher. So I don't know if Phyllis where she is, if she's in the Caribbean. Phyllis, where are you? She's in the US. Yeah.
Oh, she's white or black?
Are you you heard that question, Phyllis? You can tell us. She has lupus. She's black. She has
She's
lupus.
black.
Yeah.
Because I was going to say, if she have lupus, I'd more want her to be on around 10,000 unit daily.
Yeah,
she
which is what she
and 4,000 and she have adequate levels.
yeah.
So there's some the story a little bit more complex there, but we don't want to confuse people too much.
All right,
Because
yeah.
people have a genetic thing whereby about it with a small less than 10% of people are more like about 5%, where they might have a handicap where they don't absorb vitamin D as efficient as the people who don't have a certain mutation. Okay?
Okay.
But it's a minority of people. So those people might find that they're taking them vitamin is more with D2 too. They might be taking them vitamin and it not coming up, even though they're on relatively high dose, right? They might have that mutation.
Okay.
And sometimes you change from the D2 to the D3, it might improve a bit. And if it still not come up, those people could go on higher levels, or these were people who could jump straight, bypass the liver, and go straight to the 25D.
Okay.
You hear me?
Yep.
Yeah. But there's a minority of human beings.
Okay. All right. So thank you, everyone. Thank you so much, Dr. Pottinger. This was very, very informative. I learned so much. I have a lot here in my notes. I'm going to take your advice on the K1 and K2 because I am on the K2 as well, the K1 and 2. So thanks for that vital information. So folks, thank you everyone tonight for those who asked questions. This video will come up on YouTube. We'll get it edited and then posted on YouTube, on my channel, so you can see if, sit down and take your notes and absorb what doctor is telling us. It's a lot, lots of big words, but doc, a friend of mine here, Benny, she was just saying all the confounding things you learned in chemistry is now making sense, some of it. Like when you broke down the
organic chemistry.
the
Organic
chemistry, the
chemistry, yeah.
C28, the 44, yeah. So I went back to alpha and my chemistry days.
Yeah.
So yeah.
So I hope that the finished video of this is of good quality, because
Yes.
if I would want to send it to some of the ministers, they might, especially the people them in the ministry of health and
Yes.
some of the doctors, them especially like the oncologists, them and thing. So you know what I mean, I kind of lapse a little bit to a lot of my patients on vitamin D supplementation, but I think I need to up it, because a lot of them on 4,000 or 5,000, and even though you must monitor it, and if them between 30 to 60, they'll be all right. I feel it will do no harm, because this thing is not toxic. Even up to, I tell you, up to 150. Yeah.
Wow.
And the Master
Okay.
and they're running them levels, and the Coast Guard people them and lifesavers and thing in Miami running them over 100 and not doing them not. Okay.
Wow. That's amazing to know though, especially about the Maasai. I didn't know that. And this is just from the sun.
Yeah, because they spend long hours in the sun without any clothes on, more than just covering the line area. All of we should go back to that.
Yeah, well, it's Adam and Eve caused it, so I guess. Anyway, well, we have to wear clothing.
All right, cool.
Anyway, so you guys, the YouTube channel is in the chat.
Said was clear, right? Because
yeah,
I try to break it down as simple as possible.
Yeah. Break it down where your grandson can understand. So
yeah,
thanks for that. Yeah.
All right, cool.
So guys, the YouTube channel is in the chat. We have conversations with that Doc mentioned about cervical cancer. Please, ladies, share with your young girls in your family as young as you can as possible. Polycystic ovarian syndrome and ovarian cancer. Please rewatch them, please. Especially PCOS. I didn't know even before you get pregnant, you can prepare yourself to avoid the cycle of that. So listen to those videos, take your notes, and share with the young ones in your family. Let us break some of these generational cycles of issues that we have, okay? So thank you, everyone. Thank you, Doc. I truly appreciate this. And yes, so next time we're gonna talk about metformin.
Topic, but you see, the metformin talk is a serious talk.
Okay, so is it a metformin or is it diabetes? What is it?
Hey, you should be understanding them things that by now. Every week they talk about it,
Yeah.
Metformin is the drug.
The drug.
And this drug was discovered like 80 years ago. It was first discovered in a weed called the French lilac. It grow wild abundantly around the Mediterranean region.
Okay.
And since then, it has been used as a frontline treatment for type 2 diabetes.
Diabetes, right.
Just like how the vitamin D was initially being used for rickets. And as time go along, we're finding more and more role for it, right?
Right. So we talk about that next.
Going along, we're finding that metformin is a crucial molecule.
Right.
For a whole heap of things. And they are using metformin and glucophage interchangeably. Just glucophage is a formulation that have metformin in it, but it have other things too that make the metformin more tolerable.
Okay, so that's not our, don't reveal more, that's our next conversation. Perhaps in 2 weeks' time. I know Carnival hyping up in Trinidad. Hopefully we can get more people on. So thank you, Doc. This is truly appreciated. Night, everyone. Have a good night. Take care of yourselves. Take care of your health. Check in the channel. Okay, Doc. Have a good night.
Thank
Peace
you.
out. You are most welcome. Bye, everyone. Stop this recording. Okay, somebody's asking where you can get by the invite. You check us on YouTube, Facebook, Instagram. It's all there. So I'll put them on Facebook. I don't know how you got on this time, but we use the same channels to advertise. Yeah. Thank you. Bye, everyone. Bye, Doc.
Turn off the camera now.